Now, as the 2021 virtual edition of the World Cancer Leaders Summit is coming to an end, I would like to remind you all that the videos of all the discussions, the interviews, keynotes that we've heard over the last few days will be available very shortly in the digital library of the Summit platform. They'll be available for 3 months from now. We are also now approaching the exciting announcement of the 2 winners of the UICC 2021 Outstanding Contribution to Cancer Control Awards. Now, these awards recognise and celebrate the outstanding work of individuals whose efforts have contributed to advancing cancer care and control. For the winners' announcement, we welcome back UICC President Dr. Anil de Cruz.
Thank you, Hannah. It's now my great pleasure to present to you the winners of the Outstanding Contribution to Cancer Control Awards. This distinction recognizes and celebrates the outstanding work of individuals whose efforts have contributed to significantly advance cancer care and control regionally and globally. The first award in 2019 was given to His Excellency Dr. Tabre Vasuez, the President of Uruguay, an oncologist and a long-standing global advocate for non-communicable diseases and tobacco control, who sadly passed away last year. This year, there are 2 award categories, the Policy Makers category and the Civil Society category. The 6 outstanding finalists presented to you in a video message from Professor Jeff Dunn, the President-elect of UICC, have been chosen from a pool of 18 submissions of the highest caliber. The shortlisted nominees in the Policy Makers category are His Excellency President Joe Biden, President of the United States of America. His Excellency Minister Greg Hunt, Minister for Health and Aged Care, Australia. And His Excellency President Paul Kagame, President of the Republic of Rwanda. The shortlisted nominees in the Civil Society category are Dr. Myra Kalafi, founder of FIMAMA and a breast surgeon, Dr. Paul Farmer, co-founder and chief strategist, Partners in Health, and Ms. Pat Garcia Gonsalves, CEO of the Max Foundation. As you would appreciate in the introductory video, these outstanding individuals have contributed enormously to advancing cancer care and control in their respective settings and beyond. The judging panel, composed of 19 representatives from the UICC board, the scientific journals, and the ASCP, had an incredibly difficult task to go through and rate all the submissions. I'd therefore like to thank the members of the judging panel for all their hard work related to the awards. I know it wasn't easy given the exceptional profiles of the nominees. The judges looked at several criteria, including the impact, reach, connection with the summit's theme, that is, driving innovation to advance cancer control equitably, as well as how inspiring the individual stories were. Regardless of their profession and geographic location, these individuals have something essential in common. They have significantly contributed to advancing cancer control and care and have been doing their best to serve the cancer community. On behalf of the entire UICC family, I'd like to thank you for your outstanding contributions. And here comes the moment that I will reveal this year's winners. It's my great pleasure to announce the winner of the Outstanding Contribution to Cancer Control Award in the Civil Society category. The winner is Pat Garcia Gonzalez. Congratulations, Pat. The judging panel is pleased to recognize you for your role in leading the Max Foundation, which is accelerating health equity by increasing global access to treatment, care, and support for people living with cancer around the world. Pat, it's now my great pleasure to give you the floor and listen to your story.
Thank you, Anil, and thank you to the UICC and to all the judges for this amazing recognition that allows me to be a voice for the forgotten patients. For the past 20 years, the Max Foundation has worked tirelessly to develop all the systems necessary to treat cancer in just about every corner of the world and to indeed show that it can be safely done. And along the way, we have learned a few lessons. First, we have demonstrated that it is actually possible to treat cancer in low-income countries. We also learned that providing access to treatment is a lot more than making drugs available in a country. Diagnostics and social determinants of health are pervasive barriers, and any successful access program needs to take a holistic approach and measure success through patient outcomes. Our end-to-end access model minimizes the risk both to the patient and to the companies. And we have also learned that even though our efforts are to help patients, we also help strengthen the local healthcare system. And then when we help a patient, we do a lot more than that. We are supporting families and strengthening communities. We're decreasing stigma, and we're providing dignity and hope. With that in mind, I am on a mission to change perceptions so it is no longer acceptable to leave these patients behind. Inaction is no longer an option. I deeply believe that geography should not be destiny and that all people should be able to go through their cancer journey with access to the treatment they need and with dignity and with hope. We can prevent unnecessary suffering and premature death today. And because we can, we must. So on behalf of the courageous patients and their families, the 600 partner hematologists and oncologists in 72 countries, our partner patient organizations and patient leaders and all our implementing partners, and my mighty team of 65 strong, I thank you from the bottom of my heart.
Thank you very much, Pat, and congratulations to you again. And now it's my honor to reveal the winner of the policymakers category. The winner is His Excellency President Paul Kagame. Congratulations, Your Excellency. The judging panel has chosen you among two other brilliant policymakers to recognize your equity-centered leadership in health and cancer care, which improved the quality of your national health system and facilitated access to treatment and care for all the population of Rwanda. Your Excellency, the floor is now yours, and we'd love to hear some words of inspiration from you.
Professor Anil de Cruz, President of the Union for International Cancer Control, ladies and gentlemen. The Outstanding Contribution to Cancer Control Award is a deep honor. I thank the Union for International Cancer Control and the judging panel for recognizing the efforts that Rwanda has made to prevent and treat cancer. I also wish to commend the immediate past president of UICC, Her Royal Highness Princess Dina Mired, for her exceptional leadership and commitment to the field of cancer control and her attention to Africa. I congratulate my fellow finalists from both the policymaker and civil society categories whose collective achievements inspired us all. A cancer diagnosis is frightening in any setting, and if there are no accessible treatment options where you live, there is also a sense of hopelessness. But there is a lot that any country can do to control cancer, no matter its income level. In Rwanda, the National Insurance Scheme started to cover annual checkups for all citizens above age 40. This has allowed for earlier detection of cancers and better treatment outcomes. The top two cancers in Rwanda are breast cancer and cervical cancer. The structural focus on maternal and child health in Rwanda's health system has helped us to give these conditions the attention required. There is now 97% vaccination coverage for HPV, the virus which causes cervical cancer. Regular awareness campaigns teach women how to self-screen for breast abnormalities. Our region has some of the highest rates of liver cancer in the world due to untreated hepatitis infections. In 2018, we began an eradication program for hepatitis C, which screened more than 5 million at-risk people. Those found to be infected received treatment free of charge. We also made hepatitis B vaccination routine. Early detection is only relevant when treatment is available and accessible. Since 2019, the Rwanda Cancer Center has been operational, offering both radiotherapy and chemotherapy treatments. This means that Rwandans no longer have to travel abroad for many cancer treatments. Local production of morphine has reduced the suffering of patients in palliative care. Partnership is essential. The modest gains that Rwanda has made in the diagnosis and treatment of cancer have come by working together with others. Starting in 2012, the Butaro Cancer Center of Excellence has offered state-of-the-art treatment to thousands of patients in a rural setting in northern Rwanda. This facility is the result of an innovative partnership between the Rwandan Health Ministry and Partners in Health, led by Dr. Paul Farmer. And next year, we will inaugurate the African Training Center of the Institute for Research on Digestive Cancers, IRCAD, led by Professor Jacques Maresco, a world leader in minimal invasive cancer surgery. We still have a long way to go in the fight to control cancer in Rwanda and Africa, but this award motivates us to aspire to do even more and better in the years ahead. I share this with all those who made it possible. I thank you for your kind attention.
Thank you very much for these words, Your Excellency, and congratulations again. We are delighted to have two such outstanding winners today, selected among 6 brilliant individuals who are all having a significant and positive impact on cancer control. Congratulations and thank you to all of them. I will now hand over to our MC back in the studio in Geneva to take over for the rest of the program. Thank you once again.
Thank you very much, Dr. De Cruz, and congratulations, of course, to Patricia Garcia Gonzalez and also to President Kagame for your awards.